finding out that I have PCOS has taught me is to be radically curious about how my body reacts or interacts with the world, interacts with itself. Like I said, it's been a beautiful, empowering journey that's forced me to get to know the body that I'm living in. And if anything, I hope that after this conversation, people are also encouraged to be curious about this body.
Yeah.
And some would even argue moodiness. And I think it's so important that we talk about that, because people will just go, oh, you're just a grumpy person. No, there's actually this experience that I'm having that makes me sometimes struggle with regulating my emotions.
Hello everyone, welcome to another episode of ziRight Girls, where we talk all things girly and gynae. I am your host, Dr. Thembelihle Masina, and I'm joined by my co-host, Dr. Thalia Isaacs. And today we are joined by multi-award winning actress, Masasa Mbangeni. We commonly know her from Scandal, and she's currently on Netflix on Blood and Water and Heart of a Hunter. She's also has done multiple magazine covers. Welcome, Masasa.
Hi, thank you. Is it right, girls? I've always wanted to say that.
ziRight Girls. So September is PCOS or PCOS Awareness Month. PCOS or polycystic ovarian syndrome is one of the most common gynecological endocrine disorders, affecting up to 1 in 10 women. It is a chronic disease, it's a lifestyle disease, and today we're going to chat to Masasa, who also has been living with a diagnosis of PCOS, and she's going to take us through her journey.
Firstly, I want to say thank you again so much for having me. I think the work that this platform is doing is so important, and I certainly would have benefited deeply as a young woman from a platform like this. So shout out to you doctors for doing this incredible work. I love talking about PCOS because, like you say, it's actually more common than we think it is. And I feel that education is such an empowering tool because once you know better, as the famous adage goes, you hopefully do better. And so when I was diagnosed 21 years old, I had absolutely no idea what polycystic ovarian syndrome was. In fact, I'd never even seen a gynae until 21. My dear friend Tanya Sack, I happened to mention to her, I haven't had my period for 9 months. And she was like, okay, why is that normal? And it's like, well, sometimes it comes, sometimes it doesn't. So I didn't even know that irregular periods was a symptom, right? So she took me to a gynae in Johannesburg, and we did a number of tests, which included a scan, which included testing my bloods, and obviously telling her my symptoms up until that point of not having a cycle for 9 months. And I think what was jarring for me was she said I need to lose weight. And I was like 21, the fittest that I've ever been. I miss that 21-year-old body.
I know. We all go like, Lord, I wish I was. Now I'm like, I wish I was the weight that I was when I thought I was fat,
And so the first thing that I was told was I need to lose weight. And I was quite perplexed because at the time I was incredibly active. I lead an active lifestyle.
Yes, you do.
I was incredibly active. I was vegetarian still at the time. I'd been vegetarian since I was 15 years old. So I was shocked that the instinct was lose weight. And I think I wanted to highlight this because it's called syndrome for a reason. How it reflects to you or to you will definitely not be the same for me. And so what having PCOS or finding out that I have PCOS has taught me is to be radically curious about how my body reacts or interacts with the world, interacts with itself. So, for instance, hieratism. Some women get a lot of hair. I have the complete opposite. I lost hair. Some people gain weight. I was not gaining any weight. I just wasn't menstruating, meaning that I think I wasn't ovulating and all of that. So that discovery at 21 was quite scary, because the first thing that people immediately told me is that, okay, you might be infertile. And it's just like, wait, what do you mean? This is a whole bunch of information to come at me as a 21-year-old. I don't know what the future holds, and I don't want to hear that I'm not going to be able to have children. Luckily, as a result of platforms like this, we're learning more and more that that's not the case.
So just to tag on to that, one of the things that I try to make sure that I reiterate whenever discussing, PCOS with any of my patients is the word is subfertility. It's not infertility. A lot of patients will be told by medical practitioners that because you have PCOS or PCOS and you have an ovulation, meaning you're not ovulating regularly. Not that you're not ovulating. And so the word that I prefer to use is subfertility, meaning that you might find it difficult to fall pregnant. You may need assistance falling pregnant. Women with PCOS fall pregnant on their own without our help. And there are a subset of women with PCOS or PCOS that require our help. But please don't be bamboozled into the idea that you can't have kids, because that is just not the truth.
Absolutely.
Masa mentioned something that's quite important regarding PCOS, or the morphology or the phenotype of PCOS. So not everybody looks the same. You've got this excess male hormones. So some people may have male pattern distribution of body hair. So some people may grow like a beard. Some people may have like chest hair. Some people may have a very androgynous build, so they're quite muscular. Some people may have a high adipose tissue, especially around the central region or their waist area. And you may find that a lot of people with PCOS, they complain that they struggle losing weight. So diet and exercise usually are prescribed, because we have found that diet and exercise or high protein diet does actually improve the symptomatology of PCOS.
Diet and exercise has been my lifesaver. And I just want to talk about the acne part, because that was another game changer for me. So I was shooting, so this is now fast forward, I know I've got PCOS, and I was shooting this show that was quite stressful for me. Stressful in that I wasn't getting any sun. I'd start at like early in the morning before the sun rises, get back home, when the sun sets. So something as simple as not interacting with the sun, not having vitamin D, caused such havoc in my body. And I started getting painful cystic acne. And I hope that, I'll definitely share images with you guys. I want people to see it. And it made me feel so incredibly self-conscious, but I didn't realize that it was my PCOS reacting to stress, which is a major trigger for me. So when I am stressed out, the first thing that happens is the PCOS goes, okay, welcome inflammation. I was incredibly inflamed. When I did my bloods at that time, my vitamin D was practically non-existent. I was so depressed. And I think that's another thing that we women who live with PCOS deal with a lot of anxiety and depression. And some would even argue moodiness. And I think it's so important that we talk about that, because people will just go, oh, you're just a grumpy person. No, there's actually this experience that I'm having that makes me sometimes struggle with regulating my emotions. And I'll find myself, we all get seasonal depression, or we all get sad over life, but I'd find myself really profoundly miserable, then that would be compounded by the acne that I'd be dealing with. And being in my line of work as an actress, the first thing people look at you is your skin, and they're like, oh, what's happening? It's like, I know, don't tell me. And it got to the point where someone would, even the makeup artist would just touch my face and I'd swell up. That's how incredibly inflamed I was. And I didn't know. But because I had started reading up about PCOS, I was seeing an endocrinologist, I was seeing a gynae. Immediately, because I had the knowledge and the education, I knew, okay, this is what's happening, and I know exactly how to get help.
And you've actually touched on something very important, Masa, that PCOS should actually be managed as a multidisciplinary condition, because obviously it affects multiple areas in your body. So it affects your skin. I'm not a dermatologist, so obviously a dermatologist would know better how to treat your acne. You need to involve your dietitian so you can get like a proper diet plan to manage your condition, as well as a physical therapist that would assist with proper weight loss or an exercise program that would be effective and beneficial. You also need to definitely involve an endocrinologist, because we know that it affects multiple endocrine systems or the hormone systems in your body. And PCOS does also have the potential risk of causing diabetes in the long term. So thank you for that.
So PCOS, in the word, in the name of the disease is the word syndrome. So syndrome is a constellation of symptoms that's sort of, in a package. And as Masasa has alluded to or has told us, it's not everyone is the exact same. So just to break down, usually like when you're coming to your gynecologist, what makes us think that you might have polycystic ovarian syndrome? So there is a triad of symptoms, and you only need 2 out of these 3 criteria in order to have the diagnosis made. One of them is irregular periods, and the pattern of menstrual bleeding in someone with PCOS is usually that of absent periods for a period of time, followed by torrential, heavy bleeding. It can also be irregular bleeding in terms of short cycles, so under 21 days. So sometimes people will have 2 periods in a month, maybe at the beginning of the month and the end of the month. But if there's 21 days or less between those periods, then that's the other pattern of bleeding. Then we have what is called a high androgen excess. So that is when you have a higher level of male hormones in your body than what is normal for a female. And that can either be seen clinically or it can be done biochemically, which means done on blood tests. And we normally see that as hirsutism, which is male pattern body hair. So facial hair, mustache, beard, chest hair, thick hair on your thighs, on your back, on your abdomen, and also hair loss. So the male pattern balding. So that's the other one. And then there is the cysts in the ovaries. I find a lot of women think that when we say polycystic ovarian syndrome, they're expecting to have these massive, like tumor-like cysts, and it's not actually that. So back in, and I'm going to give my age away, back when I was in...
Black don't crack stuff.
When we were growing up and when TV, for the kids back there, when TV was being invented, there was an advert. I don't know, Masasa, if you still remember that advert, but there was a text advert. And this guy would pull up in his Jeep and get out of the car, and he was eating a text, and he looked at the holes in his text, and then he looked at the billboard, and then he was like, they don't match. And then he shot up so that's how I describe it. It looks like that text. So it's actually small little bubbles. So those are your eggs that get trapped in primordial phase. And so we see those little bubbles on your ovary. So that's what we look for. There's measurements of the size of the ovary. There's measurements of those follicles. So it's not the big, like, cancerous cysts. It's those little bubble ones. And you only need 2 out of those 3 criteria. So you can have an abnormal period with acne and other signs of excess testosterone with normal looking ovaries and still fit the criteria for PCOS. You can have the ovaries and normal periods and have the androgenism, and that's what you were saying, like, it's not everyone is going to be apple shaped. So,
and I think that's the special part of it, because for me, PCOS has actually, as I've gotten to know more about it, I've actually come to see it as a superpower. So my PCOS is androgen dominant, meaning that my testosterone is high. And as a result, I build up muscle quicker.
Nice.
So for me, if I do gain weight, as I did during the pandemic, a stressful time, a trigger, I ballooned to almost 20 kilograms, which was shocking for me because I've always been someone who's active and sporty. So being that heavy was hard for me. I started getting joint pain, inflammation, an indicator for me that my body was going, I'm not okay.
Yeah.
But I was able to lose the weight in a healthy way and easy purely because of that testosterone. It needs to go somewhere. So when I'm strength training, and this is when I also started reading up again more, and realizing that when I'm strength training, I'm actually using that tea, and it's helping me build up more muscle.
Yeah.
And also love that when my gynae told me about that text ad, she described it as like little pearls, and I thought, oh, my ovaries are fancy. They're like, girl, be pretty on the inside too. So I think the reason why I share that, and perhaps to introduce some levity to it, is because as with any sort of thing that you're facing in life, your attitude, and I know it sounds so cliche, but your attitude definitely does determine your altitude and how you grapple with PCOS. You can either look at it as something that's happening to you, or you can look at it as something that is empowering, and how do I turn these lemons that I've been handed over in life into lemonade. And I think that's what getting the diagnosis and empowering myself with education has done for me. Now I know that when things are happening in my body, my testosterone's elevated, okay, let me go strength train. So how do I alchemize whatever is happening to me in that moment, I guess, for me, is what I wanted to add. Yeah.
That's quite powerful, actually.
Yeah. I don't feel like with any, particularly with PCOS, like I said, I was 21 when I first found out. It's been a number of years since then. And if anything, I found that leaning into it, being radically curious about my approach to it, being invited to ziRight Girls and coming to talk about it. I mean, I didn't know that you only had to have 2 out of 3. I had the irregular periods. I had, so even the androgen, the elevated androgen, which would sometimes manifest in others as hair loss. For me, hair gain rather. For me, it was the complete opposite. It was hair loss. It was being quite aggressive. Like I didn't realize that having that much testosterone would make me quite angry, and the psychological impact of that, because you have the cliche or the trope of, oh, the angry black woman, and it's just like, I've got a lot to be mad about, number one, but also I've got PCOS. I've got PCOS, and it is affecting. So I love, Doc, that you mentioned about the multidisciplinary, and it costs money, I have to see my gynae, I have to see my psychologist, I have to see the endocrinologist, I have to see the dietitian, I have to get bloods taken. I mean, whenever we have to check my levels, easily alone that comes to about 5,000 rand of just checking your, and then your doctors are very excited, ticking. I'm just like, ching. So yeah, it has been a journey, but like I said, it's been a beautiful, empowering journey that's forced me to get to know the body that I'm living in. And if anything, I hope that after this conversation, people are also encouraged to be curious about this body and how do they live their best life knowing about what's going on in this body. So yeah.
That's actually very great, Masa. Thank you for sharing your lived experience. As we mentioned, that PCOS is a chronic condition, and as a health professional, one can never fully fathom the impact it has on one's daily life, including the financial impact and the psychological impact. I mean, it affects so many areas. If your appearance is affected, I mean, you're a public figure, so it's quite important that you well manage, because your face is your meal ticket. If you're struggling to gain weight, you use your body physically as well. So for some people, it's not as important, but for somebody like you, this may be a very important impact on your career. So thank you for sharing a lived experience. It's actually very empowering listening to you. So we've touched a bit on the management of PCOS. So how I usually explain is that PCOS is a chronic condition, and basically it affects you in different ways in different stages of your life. So like you, Masa, you mentioned that you were diagnosed at the age of 21 when you noticed that your periods have been absent for a couple of months. Obviously for a young person, that's important or that's worrying, but most people are commonly diagnosed while they're trying to get pregnant, and they're noticing that maybe there's a delay or reduced or difficulty in conceiving. And the commonest way we would use or method we would use to regulate your period is using combined hormonal contraception, or the pill as it's commonly known. So the combined hormonal contraception basically helps because, one, it reduces the sex hormone binding globulin, so basically decreases the amount of circulating male hormones. It also improves your acne. There's also certain pills that contain a specific anti-androgen hormones in them, and also because now your body is controlled by the cycle that is on the pill, you will then get a regular period.
Yeah, Doc, I'm so glad that you mentioned that, because I was put on a pill, and let me tell you, it wreaked havoc on my mental health. And Western medicine has its place, but the heavy reliance on the pill has been to the detriment of a lot of people getting to know themselves, because yes, it does bring back your period, and perhaps the regularness of it is kind of soothing, but we don't talk about the effects on your mental health.
Yeah.
And as a young woman who was put on the pill, I thought, okay, great, this is going to resolve everything. But I didn't realize how depressed I became. And so it became again now a game of, okay, come off this pill, put on this one. No, don't be on this pill, go on to the IUD. Take the copper IUD out because you're bleeding nonstop. So I think it's so important that yes, if it works for you, go for it. But again, the gift of PCOS has been this radical curiosity about my body, and this dialogue that happens between it of, okay, so I don't do well on the pill, but I realized that if I train and I eat well and I eat largely plant-based, my inflammation goes down. I manage my stress to the best of my ability that one can manage stress in Cyril's economy. It helps, but the pill part, I think for me as a young woman, I wish I'd known that there are other alternatives.
So as we've said, like in a few of our other episodes, that it is supposed to be like a two-way channel and a dialogue between you and your health practitioner. What works for me might not work for you. What works for you does not work for Lee. And pills are also in themselves not one size fits all. There are a number of different pills. Yes, they're all combined oral contraceptives, but the makeup of them are different. The estrogens in this one is not the same as the estrogens in that, and the progesterones in this one is not the same in that. And yes, so we have to. It's not a trial and error, but it's a figuring out phase. It's a figuring out phase. And then you mentioned something so important, Masasa, is that pills have side effects, right? Like a lot of our hormones have some side effects that are so unacceptable to women, because living with my acne and my PCOS might be more comfortable for me than what the pill's doing. Depression is one of them. Some women complain about reduced libido, dry vagina. I remember sitting in a lecture as a 22-year-old med student, and they threw up the list of side effects that are caused by pills, and I was like, so does the pill make you not pregnant because you don't want to have sex and it's impossible because your vagina's dry, or is it because it's like stopping your ovulation? That is something that needs to definitely be spoken about more, and lift your voice, raise your voice, and tell your health professional that this one that I'm on currently is just, it's not for me.
As I was about to say that it's not a one-size-fits-all. That's why we have hundreds and hundreds of pills out there. So we're always trying to evolve and develop ones with the best side effect profile, because obviously we want something that people can take and can tolerate. So PCOS, we need reliable contraception because it's also a matter of subfertility and not infertility. So we don't want people to rely on the fact that they have PCOS and therefore they cannot get pregnant. So reliable contraception is a major issue, especially in our young women and in our population. We don't want unplanned pregnancies, so we just want women to have options. Diet and exercise as well can have a major impact on the symptoms of PCOS, and it can improve ovulation rates by even up to 50% if you lose a certain amount of body weight. So now diet and exercise or lifestyle changes do not just become a nice thing to do. It becomes a prescription. It becomes an order.
Yes,
It's
I
an
love
order.
that.
And then also there are other non-hormonal therapies as well that are ever evolving, as Lisa has said. So I'm sure you've heard the word inositols being thrown around.
Yes, I have taken so much of that.
So inositols is the new, well, not so new, but it's the new buzzword where PCOS is concerned.
Yeah.
So inositols, they're naturally occurring in the body. They are cell signalers or cell messengers. They improve your egg quality. They improve your fertility. So that is also another option. Sometimes, like you say, contraception is contraindicated, whether it is for a personal reason or a medical reason.
Yeah.
Like not everyone can take contraception. There are some conditions where it is completely taboo and you cannot give a woman hormones. And so those are the new kids on the block that I also find that they're a little bit more acceptable to people when you tell them like, okay, there's this other alternative and you're not going to be hormonally like medicating women, because women don't really want external hormones.
No, we don't.
I love hormones.
No, women don't. Women
I go mad.
My dysmenorrhea improves my acne, so hormones are my friend.
Fair.
So there you go, guys. Like
Evidence of what we just talked about, isn't it? Yeah.
yeah, everyone is different.
Yeah.
But that's the new kid on the block, and coenzyme Q10 as well is also coming out in the forefront of managing PCOS. So there's that. So there's diet and exercise. There is inositols, which is quote unquote supplementations, and then there's obviously like our hormonal therapies as well. Lihle, do you want to talk about surgery in PCOS?
So surgery is a little bit controversial.
Oh, I didn't know there's surgery. I am all girls. Okay.
Masasa, don't get excited. Do not get excited. There is a black label.
Yes. So surgery is a little bit controversial. You've got these polycystic ovaries with multiple or lots of follicles that are secreting excessive hormones. So they secrete excessive estrogen, which ends up turning into testosterone. So literally when you do surgery for PCOS, you want to try and decrease the burden of that excess testosterone. So it's a procedure that is called ovarian drilling. So you go in, often laparoscopically, and you drill or burn holes into the ovaries. And obviously with that, you're aiming to destroy some follicles, which would decrease the amount of hormone secreted. That has been shown to actually improve ovulation. However, remember when you do this ovarian drilling, you may destroy other normal tissue which you did not intend to do. So we don't see men busy drilling holes into their testes. So why do we treat our ovaries like that? Because if you decrease or destroy some of your ovarian tissue, it does have an impact on your future fertility. It does have an impact on your longevity as well, because we don't only use our estrogen for fertility only. We also need it for bone health. We need it for cardiovascular health. So it's very controversial because the benefit is minimum compared to a possible increased risk in future. That is why that ovarian drilling is not the first thing or the standard thing that we suggest to you.
Okay. Well, this is the first time.
Maybe mentioned.
Yeah,
Yes.
I've never heard it before, so I think there's a reason why.
There's a reason why, but just to put it out there, like in case anybody is being advised by someone that they can do surgery for PCOS, we're trying to say that it's not the first line, it's not the second line, and it has risks and complications.
Yeah.
Remember, every time you cut in your body, you're risking bleeding, you're risking infection, you're risking scar tissue developing. Ovaries are quite
complications.
yes, and also like the ovaries are close to your tubes. We don't want to take someone who has subfertility and now render them infertile. So it's not a first line therapy. It's basically what we just want to get out there.
Oh, drat.
Can I ask a question?
Yeah, you can ask me a question. That'll be a good way. We haven't done that in a while.
Yeah. So, Talia, can you tell us about the long-term effects or consequences of PCOS?
So, as we said before, it's a constellation of symptoms. It's a syndrome. It's an endocrinological syndrome or endocrine syndrome. And endocrine means hormones, right? So hormones regulate things. They're just messages that your body sends from here to there to tell that one to do something. And so it affects not just your ovaries and your menstruation, but it affects other signals that your body is telling other organs to do, in particular, like hypertension. So you are at risk later on for hypertension. There is a risk of insulin resistance and diabetes. And then the other one, that because of the lack of menstruation, if you don't shed your lining on a regular basis, your lining then has an opportunity to make mistakes when it's developing. And that then can lead to uterine or endometrial cancer, not in the immediate setting, but later on in your life when you're looking at like your 50s, your 60s. So it is...
Girl, that's not later on. That's like 10 years later.
Guys, some of us are still living in denial. But yeah, so like for the ladies that are like, getting the diagnosis at the age of 21, when you're in your 50s and your 60s, then it becomes important to regularly see your gynecologist and have your transvaginal ultrasounds, which is not a comfortable, it's a very intimate, sometimes embarrassing examination that needs to happen. But the importance of that is that we need to be checking the thickness of your lining, and so that we can prevent and treat early things like uterine cancers. So yeah, that's the long-term sequelae of having PCOS.
I think it's so great that you talk about the relationship that one, or alluded to it certainly, the relationship that one has with their gynae. Because I think a lot of us were taught to be scared of our health practitioners.
Yeah.
And there's this movement of integrative medicine now that's really forcing people to dialogue.
Yeah.
And I think my saving grace has been dealing with health practitioners that dialogue with me.
Yeah.
That if this isn't working, let's try this. And so thank you for sharing that, because I didn't know, for instance, that there's a higher risk.
Yeah.
Risk doesn't mean that it's absolutely going to happen.
Yeah.
It's just that there is a risk for that. And so that now brings another conversation that I can have with my gynae of like, so I learned this from ziRight girls. How do we then dialogue to make sure that
gets covered?
Yeah.
That's good.
Sure.
So there you have it. Thank you, Masa, for joining us and sharing your journey of living with PCOS. And remember, PCOS is a chronic condition. Although it is often associated with anovulation, this does not mean that it's a death sentence to your fertility. PCOS can have a good future fertility. And remember, lifestyle changes can have a great impact as well on improving the symptoms of PCOS. So lifestyle changes are a very important partner in the treatment and management of PCOS. We hope you have enjoyed this episode and have gained a lot of knowledge as much as we have. And we hope,
until next time,
ziRight girls. Hey. I've always wanted to say ziRight girls. ziRight.